Good morning, everybody. The topic for today is the relationship of vitamin D, vascular endothelial growth factor, and pigment epithelial drive factor in posterior segment disease of the eye. So the aim was to study the plasma levels of VEGF, PEDF, and vitamin D in posterior segment disease of the eye. This study was conducted on 93 patients. Patients were segregated in Group A and Group B. Group A comprising of 60 patients and Group B 33. Group A mainly patients with disease of posterior segment of the eye, and Group B age, gender, healthy, control matched. Any systemic inflammatory disease, any autoimmune disease, history of retinal laser photocoagulation, any intraocular surgery or use of corticosteroids or oral vitamin D supplementation in the past 3 months were excluded from the study group. Detailed history examination was done, fasting blood samples were collected, and VEGF, PEDF, and vitamin D estimation was done using ELISA kits. So out of the 60 patients in the study group, patients with diabetic retinopathy formed the majority, followed by RVO, age-related macular degeneration, uveitis, and Eales disease. So plasma vitamin D concentration was found to be significantly lower in the disease participant because compared to healthy control. As we can see in this chart, Group A comprising of 16.79, and in Group B it's 24.87. Serum VEGF was found to be significantly higher in disease participants, being 235, and as compared to healthy controls, 99.14. Serum VEGF was found to be negatively correlated with the serum vitamin D level, and this correlation was statistically significant. Serum PEDF concentration was found to be significantly higher in disease participants group, 14.24, and as compared to healthy control, being 8.22. Serum PEDF levels were found to be negatively correlated with serum vitamin D, and this correlation was also statistically significant. So oxidative stress affects the RPE, leading to the development of vascular eye diseases. Vitamin D is known modulator of oxidative stress and angiogenesis. Vitro study was done in 2020, which was carried out to evaluate the protective role of vitamin D on RPE cells. Murugeshwari et al. Observed that vascular signaling modulators such as VEGF and Notch were reduced in hyperoxic condition, but significantly upregulated in the presence of vitamin D. These findings may give impetus to the potential of vitamin D as a therapeutic agent in hyperoxia-induced retinal vascular diseases. So Lu et al. In 2018 conducted an animal study based on evaluate the mechanism underlying the effect of vitamin D on diabetes-induced retinal vascular damage. And they also concluded vitamin D decreases diabetes-induced ROS and exerts the protective effects. In our study also, it has been seen that vitamin D was significantly decreased and VEGF and PEDF was increased in posterior segment disease, thereby indicating a possible angiogenic pathogenesis. Lower vitamin D levels were associated with higher level of VEGF and PEDF, and that is, they were negatively correlated. So key message is vitamin D may act as a novel target for therapy in disease of the posterior segment of the eye. Thank you.
So you recommend that all patients should be given vitamin D?
Not all patients, ma'am, but it has been seen like in early in the disease, the levels are, it can exert a protective effects.
Your patients were from 2020, right?
Yeah,
the studies.
Yes.
So have
pre-COVID.
Yeah, and any changes in the response or the performance of the disease subsequent to vitamin D supplementation?
We have not
really analyzed that.
Yes, this is
because because you have a lot of different kinds of the common final point might be an inflammatory component, but the different diseases have different other components, also, and therefore the vitamin D should have different
yes, ma'am. Okay. No.